Hello, everyone, and welcome back to Atlantic Coast Aesthetics. I'm Matt with ACA, and joining us once again is Dr. Thomas Pane, Chief Medical Officer of Atlantic Coast Aesthetics. Dr. Pane, this question comes from our Instagram crowd, and person is asking about what are their options to fix their Brazilian butt lift. Dr. Pane, what would you recommend?
Well, this is a good question. Now, with this procedure being very popular, especially for us here in South Florida, but also in other parts of the country, some of these issues are going to come up. Now, we don't have all the information we need to answer this comprehensively. Person had a liposuction fat transfer, commonly known as the Brazilian butt lift, and the pictures that were sent show that there was, big, subcutaneous fat around the waist, some in the abdomen, and the backside was not totally flat. It had some shape to it. Now, what we're seeing is there is some more volume to the buttocks, and there's improvement of these other areas, but they're not really improved. There's still a lot of fat around the waist. The abdomen is not completely flat. So we don't know when it was done. We don't know how much fat was taken out or transferred in. And if we're talking about the abdomen, because pictures were shown of the abdomen, I think that there's some intra-abdominal fat and some laxity of the abdominal wall. Now, keep in mind, liposuction is not going to fully improve that. We're talking only about the buttocks. What I think can be done here is a second liposuction fat transfer, thorough lipo, getting all those areas addressed real well, and then transferring all the available fat, if the tissue will accept it, to enhance the volume, more substantially. We have to see in person what they're really looking to accomplish. Keep in mind that the second procedure, you need to wait enough time so that all the scar tissue from the first liposuction can soften down and allow the second procedure to be done. And it also, you have to have enough fat available. I think there is enough fat here, but it's hard to tell just by looking at these pictures only. And keeping in mind that the abdomen will not be fully addressed by the secondary procedure. And there are some slightly higher risk of skin irregularities and things because it is a second liposuction procedure. It's not super difficult to do a second Brazilian butt lift, but you do want it to be handled by someone that does them commonly, because there are a few special issues when you do it the second time that have to be addressed. And especially if somebody was afraid to put a lot of fat in the first time, which could have been the case here, that's not ideal for doing a second one because of those other issues that can come up, because you really want to get it right. Yeah, ideally you want to get it right on the first try, but if you have to take a second try, you really want to make sure it's getting done correctly, because it's hard to do this a third time because most people just don't have enough fat available. So that's hitting the high points of the things to keep in mind when you're looking at this kind of situation, not only in this case, but in general when you're talking about secondary liposuction fat transfer, commonly known as the Brazilian butt lift procedure. So hope that helps shed some light on the situation. We look forward to seeing the next question.
Thank you, Dr. Pane. And if you have a question for the doctor, please reach out to us on our website, Instagram, Facebook, Twitter, or YouTube channel. And Dr. Pane, we'll see you on the next one.
Great.